Hey, I'm Dr. Craig Chappell at In2It Medical, and today I wanted to talk a little bit about artificial disc replacement or treatment following artificial disc replacement. I see a lot of patients coming to me for treatment of ongoing back pain following a successful artificial disc replacement. And I'm going to walk you through the process a little bit and help you understand what I'm actually trying to accomplish once the main or the majority of the work is finished. So if you look at this image, this is basically what we're looking at is a lumbar spine. The back of the spine is facing you and the front of the spine is heading in this direction. When a disc is replaced, if you can imagine, the disc is replaced because there's decreased disc height, which creates narrowing of the foramina or the openings where the nerve roots exit. Once the artificial disc is placed, it actually adds height to the individual and stretches the capsules surrounding the facet joints as well as the supraspinous ligament and interspinous ligament. And I'll demonstrate those pieces of anatomy to you on the skeleton. So once again, we're looking at the same thing. This is a skeleton. Belly's heading this direction. Back is over here. And these are the facet joints. So these are the joints that allow flexion, extension, rotation in the lumbar spine. When a disc becomes degenerative or compressed, there's a lot of excess force going through the facet joints and they become bulky or get bulky or arthritic, whatever you want to call it, and sick and they hurt. So not only is the disc the problem, but the posterior spine is a problem as well. There's also a ligament that goes from the head all the way down to the sacrum called the supraspinous ligament, and there's a ligament in between each one of these bones. These are called spinous processes, called the interspinous ligament. All of these ligaments are affected following an artificial disc replacement. They're affected because they're compressed and tight and they grow in that direction, and then they're stretched out pretty dramatically through that procedure. This problem creates pain secondary to stretching the ligament dramatically over a very, very short period of time. If this were an ankle, we'd call it an ankle sprain. The same thing happens. A ligament is stretched, part of it tears, and now it has to heal. So following artificial disc replacement, a lot of people complain of this posterior pain. They describe it by putting their hand on their back and saying it hurts right here. They describe it as achy, usually a dull ache, sometimes burning, and is alleviated with ice or heat. So I'm going to walk you back through this process a little bit of what goes on and what we're treating. So this is once again just a description of the anatomy, and this would be normal anatomy showing great disc height spaces on this x-ray. If we go into an abnormal picture, we see that these black lines, the area between each bone has decreased, and we call this a degenerative disc disease or degenerative spine. It could be also associated with disc herniation or other pathology, including arthritis of the facets. And that's kind of what we're treating as we go through here. This is a real patient now with great disc heights in this region, and then we get to L4, L5, and L5S1, and we see the disc height diminish. It goes down. And so this person actually loses height in their stature. And then following disc replacement, we see how shallow or small those spaces are. We see that at the L4-5 level, an artificial disc has been placed, which increases the height of the spine. But it's uniformly increased. It just doesn't increase it in the anterior spine or the front of the spine. It actually increases in the back of the spine as well, which puts a ton of pressure on the facet capsules and ligaments as well as the supraspinous and interspinous ligaments, creating a lot of pain following the procedure. So it's not that the procedure didn't work. The procedure worked very, very well and usually resolves the radicular or that radiated pain almost immediately. But when you stretch a ligament that quickly, you can, like I said, you can refer to it as a sprain or even a partial tear of the ligament, which does require some work afterwards. And here's just another picture, once again, of the compressed, this is an MRI, and we see the compressed disc or the loss of disc height. And then in the other image, this is an x-ray of the same person, we can see that increased height between those spaces, resulting in that posterior back pain or ligament stretching phenomenon. And once again, just another picture showing multiple discs being placed. So if you gain, half a centimeter of height over each space, you can add 3/4 to an inch of height back onto your body based on this procedure, but remember, each one of those capsules have been stretched dramatically. So when people come to my office with this problem, they come for regenerative injections. In this case, we generally use either platelet-rich plasma, referred to as PRP, or a stem cell solution derived from bone marrow, and inject the solution back into the affected ligaments, which adds integrity to that connective tissue. If I add integrity to that sprained or injured ligament, your pain will diminish. And that's how I utilize regenerative medicine in the presence of an artificial disc replacement. So I hope this helps. I've had a lot of patients request that I provide this information of what my thought process is and how it actually works, and it seems to do very well. So thanks for your time.